Hello, and welcome to the Basic Surgical Skills topic. By the end of this session, you should be able to recognize all the common surgical instruments used in the operating theatre, recognize the different sutures and needles used in surgery, and understand the different suture techniques and their applications. Let's get started. Generally speaking, for any successful surgery, a surgeon requires tools to cut open and access tissues, for bleeding control, and for anatomical restoration of closure of the surgical wounds. This is where surgical instruments are required. So let's see the first category of surgical instrument, which are the cutting instruments. Scalpel is a definitive cutting instrument used to create linear wounds and dissect tissues for procedural purposes. There are two types: the reusable type, which consists of metal handles and exchangeable steel blades, and the single use type, which consists of plastic handle and steel blades. Then we have the electrical scalpel, which is a needle like surgical instrument that uses radio frequency alternating current to heat tissue, also known as the electric knife or the radio knife. The current forms of a tiny electric arc at the point, and it can cut or desiccate tissue, sterilize the edges of the wound, and also cauterize the cut blood vessels. Next would be laser scalpel. This is a surgical instrument used to cut, ablate, and coagulate tissue, commonly used in general surgery, neurosurgery, ophthalmic surgery, ear, nose, and throat surgery. And finally, we have the surgical scissors. The different types, we have the Mayo scissors, which is curved for cutting and dissecting tissues, and the straight type for cutting textiles and sutures. Metzenbaum scissors for more precise cuts and delicate dissection of tissues. And finally, we have the iris scissors, which is a smaller scissor used for ophthalmic and other procedures requiring finesse. Let's look at hemostatic instruments and agents. So, hemostasis can be achieved via mechanical methods such as rudimentary pressure or hemostats, electrocautery, or hemostatic agents. For mechanical hemostasis, we can use hemostats, also hemostatic clamps or arterial forceps, surgical clips, which are mechanical devices used to occlude a blood vessel to achieve the definitive hemostasis, electrocautery, which is a high frequency electrical current that is conducted through the patient from an inactive electrode and an active electrode. And when the surgeon activates the pen, the circuit is closed and the electrical current obtained is sufficient to destroy the tissues and cause coagulation. And finally, the hemostatic agents, which help in inducing clotting processes when applied to bleeding tissues. They come in the form of tissues or sponges, sometimes foams or sprays. Example would include Surgicel or Surgifoam. Now let's look at dissecting instruments. Dissection instruments aid the surgeon in gaining depth in the tissues. Retraction instruments keep the surgical wound or work area open for further dissection. So examples include forceps. We have the indented and the non-indented forceps. The indented type is used for avascular tissues or aponeurosis. However, the non-indented type is used for vascularized and delicate tissues, including the skin. Then we have the graspers or the clamps, which is used to handle and hold structures in place. It's designed to minimize trauma to the tissues, and different graspers are suitable for different structures. For example, we have the Babcock clamps, which are used to handle the bowels, and laparoscopic graspers, which come in the form of indented and non-indented versions. Next, we have the dissectors. These are numerous instruments that are available to aid with tissue dissection. The commonly used ones include hemostats, tonsil forceps, right angle dissectors, and laparoscopic types. Next is the retraction instrument. Retractors are surgical instruments that are used to help with exposure during surgery. So they are used to separate the edges of a surgical incision or wound, and they hold back organs that are in the way of the dissection. The type of retractors include the manual types, which is done by handheld instruments used by surgical assistants, and the self-retaining type, which is a mechanical device that holds the tissues apart by itself. So the manual retractors are the more commonly used ones. Example would be a Richardson retractor. And a self-retaining retractor, for an example, would be a Balfour retractor as shown in this slide. Now let's look at the types of sutures, how sutures are classified. So sutures can be broadly classified into absorbable and non-absorbable types, where they are then further classified into the braided and monofilament type respectively. Vicryl and monocryl are examples of absorbable sutures, whereas silk and ethylone are examples of non-absorbable sutures. All sutures are classified according to their material as either absorbable or non-absorbable as mentioned earlier. So with absorbable sutures, the body will naturally degrade and absorb them over time. All suture materials are foreign bodies that set off an inflammatory response, and some materials are more likely to cause inflammation than others. Examples of absorbable sutures are catgut, which come in the form of simple or chromated, vicryl, which are braided multifilament lactide glycoside polymers, and PDFs, which is a monofilament polymer of polydioxanone. The other category of sutures are the non-absorbable types, which examples include silk. They come in the braided form and they are derived from silkworms. So they are natural types of non-absorbable sutures. And the synthetic type, which is proline and nylon, are also other examples of non-absorbable sutures. So let's look at how we select the material of sutures. So non-absorbable materials are selected for skin closure, where the sutures can then be removed later, or sometimes for internal tissues and organs where absorbable sutures do not have the sufficient strength or durability. And as for absorbable materials, it can also be used for skin closure where the sutures will not be needed to be removed later, and sometimes in any internal organs and tissues where the mechanical strength and durability of absorbable sutures are sufficient. And this is more common than using non-absorbable types. So let's look at the suture caliber nomenclature. The thickest caliber of suture used in general surgery is number 1. The following in descending order is the number 0. As the caliber of the thread continues to decrease, the number of zeros begin to increase. The finest thread available is 11 to 0, which is used under surgical microscope. And the caliber selection depends largely on the location. So, for example, if you're going to do a suturing over the extremities, you may want to use 3O or 4O. However, if you're going to do it on the face, you may prefer 5O or 6O, a finer version. Let's look at suture techniques now. So there are simple interrupted suture where each stitch is knotted as shown in the first diagram to your left. Then we have simple running or continuous sutures. Stitches are made in succession with a knot at the very end following completion of the suturing process. There's the vertical mattress type, also known as far, near stitches, used where wound edges are difficult to approximate. Horizontal mattress type, which is a simple stitch made and reversed parallel to the wound. Next would be subcuticular suture, which is buried subepidermally and can be running or interrupted. Finally, purse string suture, which runs encircling sutures that is usually placed around tubes to hold them in place, such as gastrotomy tubes or chest tubes. How about knot tying techniques? So there are two basic types of surgical knots. The square knot, which is most commonly used, these are single wraps that are thrown in alternating directions. The number of throws depend on suture material and the surgeon's preference. And the other type is the surgeon's knot. This is a double wrap which is used for the first throw and it reduces loosening of the knot. So for knot tying techniques, there are the two-handed tie, which is the most basic technique that needs to be mastered first, and the one-handed tie, or you can use the instrument tie where the throws are made with a needle holder, or a laparoscopic type, where a variation of instrument tie usually done with two laparoscopic needle drivers. Throughout your rotation in general surgery, be proactive and participate in ward work involving simple suturing and removing sutures. This skill will be very handy in any situations requiring wound or skin closure which you may encounter in the other rotations as well. We have finally come to the end of this lesson. Thank you for your time.